Hello, wonderful attendees. I'm your host, Dalvinder Kaur from Lovely Professional University. Get ready to dive into today's topic, that is recent developments in the treatment of Parkinson's disease. Before we proceed further, allow me to introduce the experts of the day. Dr. Manju Devi, physiotherapist, assistant professor, Department of Physiotherapy, Lovely Professional University. With over 7 years in clinical and academic roles, her expertise includes neurology and biomechanics. She has published extensively in top journals and significant experience in neuro and ortho physiotherapy. So now I would like to introduce admission nominee also in this webinar, Dr. Tushinder Preet Kaur, a distinguished professor at Lovely Professional University, Mittal School of Business. With over 15 years of academic experience, she holds a doctorate in economics, MPhil, and UGC NET qualification. Dr. Kaur is also an author and served as a resource person for seminars and conferences. Before we proceed further in today's session, I would like to request everyone for any questions, you can write in the chat box or in the Q&A box, and same will be addressed from my side at the end of this webinar. And now I hand over the things to Dr. Manju, and it would be an absolute delight to listen from her. Over to you, Dr. Manju. Dr. Manju, can you please continue? There is some technical error. She's just joining in 2-3 minutes. Yes, Dr. Manju, can you please
Yes.
start?
Very good morning to all of you, to all the participants in the webinar. I'm Dr. Manju, I'm from a department of physiotherapy. I'll give a little bit introduction about myself. I have a good quartile Scopus publications related to the neurology stream. And I do have a patents and the copyrights in the field of the physiotherapy. So I'm working in LPU from the last 7+ years, and I have an experience of around 8 years. And my previous experience was in the clinical practice, and now my experience more probably is in the academic stream. So here today, I'm going to introduce you with a topic which is about the Parkinson's disease. I hope many of you have done already a bachelor's program and you are planning for the master's program. And might be few are those who have just completed their +2 and they are probably planning to join a specific stream, maybe a physiotherapy, or maybe they are interested in some other streams. But I would like to tell you more about the physiotherapy stream and why there is a need of a physiotherapist in the current scenario. So first of all of us are suffering, or maybe in our surrounding, people are suffering with more of a cognitive issues, right? So cognitive or the brain related issues which are leading to neuron damages in our brain, okay? And the leading cause for this damages in our brain, one could be the lifestyle and maybe our nutrition or the habits of our day-to-day lifestyles. okay, that is impacting to our cognition as well as the neurons. So ultimately, when these neurons are getting impacted, somehow it is going to impact our body in terms of the movement or in terms of some sensations, right? So how you will deal with all these upcoming problems, because these days all of us are suffering with anxiety, we are suffering with the stress and maybe a depression, right? And this is not something which you have planned not to take, or it's just obvious that it will come to your brain, and ultimately it is going to damage your neurons. So if I come back to the topic of today's webinar, which is about Parkinson's. So Parkinson is one of the similar kind of degenerative disorder. Degenerative means it is coming with the age. Okay. And because of our lifestyles, the youngsters are having a very bad lifestyles, I would say, these days. And as a result of which, this Parkinson, which used to be in the age of 55 or 60 years of age, nowadays it is coming in the age group of 45 itself. Okay, so which is an alarming situation for us. And this is also giving us an idea that if the 45 of age group, which earlier was 60, is now shifted to 45, it means the probability of getting such patient is also going to be high in the future. So if you look in the coming 10 years of time period, so there is a probability that the neurological conditions will be more throughout the world, I guess. And you can also check the prevalence of it. Everyone in our surrounding is suffering with some kind of neurological disorders. So one is the Parkinson, which is also a degenerative disease. Okay. So I would like to tell you a little bit about the Parkinson. So Parkinson is basically a problem of a substantia nigra, which is a part of a midbrain. So we are having a brain. So brain is having a forebrain, then the midbrain and the hindbrain. So in the forebrain, there is an area which is called as substantia nigra, which will be degenerative. The neurons of that area will be degenerative, and as a result of which patient will suffer with the Parkinson. Okay. Now, those who are very, very new to this kind of topic, for them, I would like to tell that the patients, what type of presentation they are going to have. So the first thing which they are going to have is, most of them are going to have a slouched posture. Slouch means, if you can see through the webcam, okay, so the patient most probably are going to have this slouched posture. Okay, so slouch means forward bend posture. Okay, so there is no medicine which can treat the forward posture of someone. Okay, if you are having or someone is having a forward posture, it will leads to the compression of your diaphragm also. Diaphragm, I think every one of us know, those who have passed the 10th and the +2. So the diaphragm is going to be constricted or contracted, as a result of which you are not able to breathe in properly. So if you are not able to breathe in, automatically it will lead to a worst situation, right? So this is the first clinical feature in which the person is going to have a postural problem, which is a forward posture. The second most important problem, patient is going to have a tremor. So whenever they are doing some work, there will be some tremors in the hand. Automatic, this is involuntary movements which are going to happen in the human body, most probably on the distal aspects of the limb. Okay, so let's say if the person with a Parkinson is sitting and the person has to take a glass of water, the hand will be showing you a lot of tremors, which is like a jerky movements. Okay, so as a result of which the person would not be able to drink or might not be able to eat. Okay, so these are some common problems, and there are medical treatments, but those medical treatments are giving you a lot of side effects later on. It may be the loss of the hairs, it may be the loss of memory, it may be some kind of the skin issues or further cognitive issues. Okay. So medication to a certain extent is fine, because it is might be stopping or might not be stopping the problem. But what about the functional aspects? Let's say, okay, I have taken a pill or a drug, so that has resolved this problem. But what about the functional limitations? So now my body is not able to sit properly. I'm only able to sit in a slouch posture. My hands are keep on showing me the tremors, because of which I'm not able to wear a shirt. I'm not able to comb. So all those functional related tasks are now hindered. We cannot perform those tasks, right? So for all these things, there is a need of a physiotherapist, and there is a need of a physiotherapy in this particular stream. Okay, so if you want to know a little bit more about this, so we are having a medical treatment for it, which is called as deep brain stimulation. Okay, so deep brain stimulation is basically you are stimulating to substantia nigra part of the brain, which is actually not working appropriately, or it is leading to degeneration of their neurons. So when the neurons are getting degenerated, it means those are not working. So deep brain stimulation is helping you for stimulating those areas so that it will start doing their functions effectively. Okay, but this deep brain stimulation, as per the recent advances, is also having a lot of limitations. For example, there might be a failure of this surgery or this treatment even after spending a lot of money on it. Okay, and sometimes the prognosis is bad. It is not a good prognosis. Okay, so to overcome all these problems, we are having a very beneficial interventions these days, which we are considering as a neurological physiotherapy interventions. Okay, so the first thing, as this is a very short webinar, so I would not be able to explain you each and everything here. But yes, for sure, if you people will be joining here, we would be taking your lectures in a much detail. And there are lot many faculties in LPU related to neurological stream. So you can have a vast knowledge from, you can extract the knowledge from all of these faculties, which are very well experienced in the stream. Okay. So coming back to the PT interventions, the first intervention which we can start with is we should always give the Parkinson patient some heavy objects. Let's say I said the patient is going to have a tremors in the hand. Tremor is like a involuntary movements like the old age people used to have. So that is called as resting tremors. So they at the rest time, they are actually not at the rest. There will always be some tremors in the hand. To stop this, we can give some kind of the weight bearing things. For example, if I am holding a pen, okay, so we can give a specialized pen to them that will be slightly heavy rather than the normal pens. So heavy pen will help the person for a weight bearing on the joints, and that will activate the proprioceptors of the joint area, and as a result of which the person would be able to write. Otherwise, Parkinson patients are not able to write properly. Just a second. Okay. Then the second thing, these days in the market, some gloves are available. Those gloves are like a cuff bands. So you can wear those gloves throughout the day, those who are suffering with the tremors, so that the resting tremors would not occur. Okay. So this is the first thing which can be done. And this is the one clinical feature of the Parkinson. Okay. There are a lot many interventions, but I'm just picking a very superficial right now because I think all the attendees in this webinar are +2 students also, might be BPT bachelor students also. Okay, so to make both of these category students to understand, I'm keeping my lecture very simple and concise. Okay. The second thing which they are suffering, as I said, is called as the postural problem, which is a stooped posture. So to prevent the stoop posture, you can ask the person, okay, in a very layman language, you can ask the person to keep yourself in an erect posture. But if someone is saying you something, it's not 100% that you will follow it, right? Similar is the case with the patients. So they will not follow the simple commands that a layman person can give. So they need a specialized physiotherapist command so that they can correct the posture. In that command, it is not only a verbal communication, it is also a verbal, along with that, a manual cues. So we can give a cues at the back of a person around the pelvis. So you can hold the pelvis and you can give a cue to the person to keep it in an upright posture. If someone will hold your pelvis from the back and you just turn the pelvis slightly backward, it will automatically lead to correction of this posture. Let's say the pelvis is like this and your posture is downward. As soon as you are correcting it, automatically the upper trunk area will also go for erected posture. So such kind of manual trainings could also be given to these patients, right? Now I'll proceed with the third thing, which is called as rigidity, which is very, very common and the clinical manifestation of the Parkinson's. What is rigidity exactly? Rigidity means, in a layman language, people are saying it as a tightness in the body, but exactly it's not right. But for a layman person, it's right. Rigidity means if you are holding the limb of a person, okay, I'll go slide back. If you're holding the limb of a person and try to do the movements of the limb, like a passive movement, these persons would not be able to perform these movements in a very smooth pattern. Okay, so what happened? when you will do this passive movement, they will show you a movement where there is a jerkiness throughout the path. Okay. And if you are performing this for 4 or 5 times, this repetition, passive movement repetition, you will find the resistance, means the stop or the resistance which you are feeling during this movement is now is not decreased. Okay, so when you're doing a passive movement, the resistance when you're moving it should be decreased. If it is decreased, then it is called as spasticity. If it is not decreased, okay, it is not decreased and the resistance is same throughout the range, then it is called as rigidity. Okay, it is a tone issue where there is a slight more, you can say the hypertonia is happening, but with the passive movement, these rigidity is not going to be decreased. Okay, that is a classical sign about Parkinson's. If the patient is having this classical sign, in that case, you have to start with your interventions related to the physiotherapy. Here, your medications would not help. For posture, your medications would not help. Okay, so there is a need. Now coming to the fourth problem of the patient, which is about the balance. Okay, so someone who is already standing, if you can observe me, I'll perform because I don't have anyone right now. So let's say if I'm standing, this person is going to have a slouch posture. If someone is having a slouch posture, there is a tendency to fall in the front side, right? So if someone is having a tendency to fall in the front side, the person cannot walk, right? So if the person cannot walk, we have to give a training for the gait pattern of a person. So that gait pattern training is very, very crucial. Because sometimes the patients are also suffering with the freezing. Their body will be freezed. If you have ever seen a patient, or maybe in your surrounding, or maybe in a clinical practices, these patients will freeze while doing some movements. Let's say they have to get up from their bed and they cannot plan their schedule like at 4 o'clock I'll do this, at 5 o'clock I'll do this. No, their body will get freezed. Until their body is not unfreezed, they cannot start their day. Okay, that's a very challenging problem. So initiation of something is a problem in them. For those things also, we need to plan and interventions. Okay, similar for the gait, we can go for interventions such as hurdle walks. Okay, I can verbally, I can explain you. Let's say the person is not able to walk, so I can give certain hurdles in between. Let's say I have kept certain sticks here, canes or something as a in a sequence. So 1, 2, and 3 like a sequence, and the person has to walk from those hurdles. We have to give an instruction. Plus, we have to give a cues also to the person to take a jump, to take a step to cross that first stick, and then take a second step after crossing this stick. So likewise, we can give a training to a person. How much should be the step length? How much should be the step width or the distance, right? So that kind of trainings are very, very important. And these trainings, those who are new to the physiotherapy, these trainings are being given by the physiotherapist, right? Okay. Now proceeding with other symptoms. So patients with Parkinson's are also having non-motor symptoms. So what I was talking right now, these all were the motor symptoms. These patients may also suffer with non-motor symptoms, which means there is nothing related to the movement, but because Parkinson is a movement disorder, these patients will have an adjoining non-motor symptoms. For example, these patients are going to have a lot of excessive sweating. If you'll come across these patients, they will be having excessive sweating and obviously the bad odor, which people cannot tolerate, right? So that will be excessive. So that is the one problem due to which the patients are not much interactive in the society. So when you are not interacting, you are not talking to anyone, it will lead to a psychological issue to you also. You will feel depressed, you will feel anxiety, like why somebody is not talking to me. So automatically your depression and anxiety level is going to be increased. So these are some definitely need to look into the non-motor symptoms as well, because it is indirectly related to their cognition or to their psychological level. Fine. Okay. Ma'am, Dalvinder ma'am, do we have any questions or anything like that in the session?
Yes, ma'am, we will take the questions later. I would
All right.
request to the admission nominee, Dr. Tashinder Preet Kaur, to be on the screen. Over to you, Dr. Tashinder Preet.
Thank you so much, Madam Tilvinder. It was nice presentation, Dr. Manju. I also got to know so much from this presentation. Such an enlightened presentation it was.
Thank you.
Madam Tilvinder, just help me out to know whether my screen is visible or not.
Your screen is visible, dear. You can continue.
Right. Thank you so much. So, very good morning to one and all. I, Tushinder Preet Kaur, would be briefing you regarding the accreditation and the approvals which university has, the kind of placements, the extracurricular activities, last but not the least, what residential facilities we promote. So to initiate with I initiate with accreditations and approvals. The university proudly shares the information that we are NAC A++ accredited with the 3.68 score out of 4-point scale, which is one of the amongst the all dual mode regular education, distance education for the both government and the private universities, which is of immense importance. So I must highlight that this is the highest score in the first cycle of accreditation among all government and the private universities. To proceed further, in addition to this, we have certain approvals and accreditations. ACBSP is there, then Indian Council of Agriculture Research, then we have University Grants Commission for distance education as well for NCTE. Then yes, for the pharmacy, we have Pharmacy Council of India. For physiotherapy, we have the Indian Association of Physiotherapists. So the list is long, the glimpse I have highlighted. To highlight now, I'm going to initiate with the rankings which university is having. The university has been ranked second through World University is with real impact ranking. This is in the first attempt the university has secured global band of 101 to 200. If I talk about the Atal ranking, Atal is ARIAA, that is Atal ranking of institutions on innovation and achievements, which highlights what kind of innovations, what kind of patents the university is having. The university has been ranked third by Atal ranking, and this is among the highest among the university and the deemed universities. This gives me immense pleasure to share that university created the history by as 12 out of the 13 students won Olympic medals, the one of gold, silver, and bronze. And this not only made LPU students or the LPU fraternity proud, but the whole country. As these students, they not only participated but won various medals. So the university, the students also participated in Ministry of Youth Affairs, Sports, Government of India. So the faces are not new to you. They have brought laurels not only to the university, but to the country as a whole. So this is kind of the exposure, the sports exposure the university is providing. In addition to this, the university proudly hosted 106th Indian Science Congress, which was inaugurated by Honorable Prime Minister Shri Narendra Modi ji in 2019, which gives immense exposure to the students as he renamed the slogan Jai Jawan, Jai Kisan, Jai Vigyan, Jai Anusandhan by prioritizing more on research, because if the institution is doing research, that will research will be for the sciences, for the whole society. Something newness would be there. I'm pretty sure you all are aware about this face. He's none other than our Nobel laureate for peace and great spiritual leader of Tibet, Dalai Lama ji. He graced the convocation at LPU. In this glimpse, you can see the two presidents of Asia's greatest nations gracing the occasion, that is convocation at LPU. Is none other than our Union Finance Corporate Affairs Minister, yet Shri Arun Jaitley ji, who inaugurated the startup school and initiated and interacted with the students to start with the startups at the very right age. He's former Vice President of India, Venkaiah Naidu, who graced the convocation of at LPU. So apart from the convocations, we invite the lifestyle coach and motivational speaker, Gaur Gopal Das ji, who initiated with the students and interacted and told them the ways to lead a happy life. So apart from the great leaders, lifestyle coach. The university also welcomes the celebrities, the glimpse of whom you can see Deepika Padukone, Shah Rukh Khan, then Captain Mahendra Singh Dhoni. He also visited and interacted with the students. So glimpse of whom you can see all. This is the world record, Guinness World Record for the largest Bhangra dance at LPU. Now I'm going to proceed with the infrastructure which university is having. The university has amphitheaters which are used to organize Nukkad Nataks and the various events. Skit competitions are there. This is a glimpse of one of the biggest auditorium, that is Shanti Devi Mittal Auditorium, which is used to organize national events, international workshops. This is a glimpse of the lab, that is a Mac lab, which is there for the students. This is a library, multi-storied library is there, which we provided to our students with more than 20 lakh books as well as texts are there. And you have any research idea into your mind, we have softwares for the same. This is the outer view of the Unimall, wherein multi-storied Unimall is there. This is run by the students. I'll take you inside the mall. The multi-storied building with all the facilities from stationery to the stitching and to the other part, you will be getting under one roof. So all stationery, clothing, you have into your mind the basic necessities, we provide you to the things over here. Yeah, the inner glimpse of Unimall. For those who are fitness free, we do have gym facility with trained coaches. To bring you out of the academic monotony, we have bowling alley. We are worried about your health. We have 24/7 hospital facilities with doctors on the roster. These multi-specialty facilities are also provided, and bed facilities is also provided, God forbidden, in case it is required. So this is a glimpse of day view of the university. The lush green gardens are there. The inner view of the residential facility, the night view of the university in general, and residential facilities or the hostel in particular. Shanti Devi Mittal indoor stadium with the multifarious facilities. I'll take you inside. I am pretty sure you might be inquisitive to know what is there inside the indoor stadium. We do have almost 16 badminton courts, shooting range is there, basketball courts are there, lawn tennis range is there. Yeah, this is very important to highlight. 3 Olympic size swimming pool facility is also provided. So you have the things into your mind, we have it for you on the board. Now I'll take you to the website where I'll show you, I'll talk with you regarding what all eligibility, fee structure are there. Now I hope my screen is visible.
Your screen is not visible, Dr. Tushinder.
I'll reshare it again, ma'am.
Yeah.
Just allow me to do the same.
Yes. You can share your screen now. Yes.
Right.
Perfect.
Thank you so much. Thank you so much. All right, students. Now, in order to get the information, like what all programs are there, what is the fee structure, and how you can proceed, I have landed up at website. It is lpu.in. Therein you need to click at admissions. Then you need to click at the physiotherapy, and then you will be selecting bachelor's of physiotherapy. I'll initiate with the duration, as the duration for this program is 4.5 years, that is of 9 semesters. The eligibility for the same is 60% in 10+2 with the combination of English, physics, chemistry, biology. And the one mandate test is LPU nest, or if you have appeared for CUET, that would also good to go, but you need to appear in LPU nest as CUET result has to be announced, right? Now, we are entertaining the exam on the basis of online proctored exam, as well as on the test center based exams are also there. So I have already mentioned regarding what all initiatives have been taken, exposure is given. The exam which I talked about NEST, that is National Entrance and Scholarship Test. It's question paper pattern, syllabus, sample questions. You can find it on the relevant page. Question paper pattern is there, syllabus is there, sample questions are there. So you will be finding it on this particular website. Now continuing with what all academic input you will have. So it is basically a 4.5 years course. So I'm pretty sure you might be interested to know what will be taught in term 1, term 2. So you don't keep anything into your mind. You visit a website, or you can also see how I am exploring. You can also explore in the similar way, that what all academic input will be given to you. So first year, third year, fourth year, and then fifth year information is also given. Now I'm going to talk about the fee structure. It is 80,000 per semester without scholarship. Now we float this scholarship into three categories: category 3, category 2, category 1, because we acknowledge your hard efforts, and we understand, and we give you the option to appear in the university's exam on which the LPU NEST, the scholarship would be applicable. One very important point, which you should listen it very carefully. One scholarship which will be applicable to you, it will be till the duration of the program. So it's all about, you have to plan how to save money, because your saved money can be utilized for your pocket money as well, right? Okay, so 80,000 is the fee per semester. So three cutoffs: category 3 25%, category 2 30%, and category 1 would be 35%. So you can see, I'll give you one example. If you score above 80% or below 90% in 10 plus 2, 25% scholarship would be applicable. So higher you scored, higher would be the scholarship, and it's on the basis of LPU NEST score as well. So there are a lot many options. Though we have on the scholarship on the basis of CUET, on the basis of NEET, but one best scholarship would be applicable, and the applicability will till the maximum duration. Now, I'm pretty sure you might be inquisitive to know that how we have to proceed with, or what steps are involved. So one important thing is that last day to take admission is 25th of June. Never ever, plan it before that the phase changes, because I told you regarding the different slabs, that is 25, 30, and 35. So last date to take admission is 25th of June. And yes, you need to, after booking the provisional admission, then you can book your LPU NEST. You need to appear in LPU NEST. The dates are also mentioned. Registration has already started. Entrance exam would take place from 5th June to 30th of June. Its result would be out within 48 hours. So you can plan your decision accordingly. So again, I always advise the candidates not to wait for the last date, but plan your decision well in advance to save your money, to utilize it in a better way. So on this page, I briefed you regarding the duration, eligibility, what fee structure is there, what are the different types of scholarship, and what fee would be applicable in your case, and how to proceed. Now, these are the ways from where you can get back to us. For example, you want from our side a calling, you can click on the first tab, that is schedule a call. If you want to interact with our WhatsApp executive, so the second tab is of WhatsApp only. So you need to click, you will interact with our executives. Then we are available on live video counseling. Likewise, you can see me. If you click on this live video counseling, you will be directly routed to our team where one-to-one interaction would take place, because nowadays it is difficult to come from far-flung places, but we are providing you the live video counseling as well. Then comes out to the LPU in your town. If you have any query and you want to meet our executives, our team or our executives, they go from one place to the another. You click, you select your district, you select your state, district, and then you can plan your visit accordingly. So I hope I made all the points what you had into your mind. And again, one disclaimer: don't waste for the last date. Plan your decision well in advance. It's over from my side, Madam Dalvinder. Best wishes to each one of you. Hope to see you in the campus, guys.
Thank you so very much, Dr. Tushinderpreet Kaur. As I can see, there are some questions from our participants. Can we take questions with Dr. Manju Devi?
Yes, ma'am, we can go ahead with the questions.
Yeah, thanks for giving me a chance to address your questions. Mega is asking here, what are the latest advancements in drug therapies for managing the symptoms of Parkinson's disease?
For the drugs, okay, these days actually drugs are like the medicines which are mimicking to the dopamine levels in the Parkinson's. But these drugs are having, as per the recent literature, these drugs are having a lot of side effects. So we are not preferring those drugs nowadays. We are preferring if you want to know more about the medicine side, so the more probably the deep brain stimulation is the current therapy which people are taking as a surgical interventions for the Parkinson's. Okay, so if you're talking about the medicines, right?
Thank you so much, Dr. Manju. I hope, Omega, you got your answer from our experts. Thank you so much once again, Dr. Manju and Dr. Tashinder Preet Kaur. As we come to the end of this webinar, I want to express my deepest gratitude to our experts for sharing their valuable insights and expertise with us. Your presence, enthusiasm, and active participation have made this experience truly special. Hopefully, the attendees found this webinar to be valuable and will be able to utilize the information for better decision making regarding your admission. If anyone wants to access this webinar again, they can visit our website, that is lpu.in, or can be accessed on YouTube also. Stay connected with us for future webinars. Until we meet again, with the permission of my seniors, I would be signing off this webinar. Take care and goodbye. Have a beautiful day.